Hello, everyone. My name is Kate Golick, and I am pleased to introduce our speakers for this webinar. This webinar is titled Improving Family and Patient Health with Guided Imagery, presented by Pam Gampetro. Is that how you say that, Pam?
Gampetro.
Okay, she is a clinical assistant professor in the Department of Human Development, Nursing Science at the University of Illinois, Chicago. And Dr. Barbara Meagher, who is also a clinical assistant professor in the Department of Human Development, Nursing Science at the University of Illinois, Chicago. Thank you so much. We are looking forward to your talk.
Well, we're really looking forward to being here, and off we go. This will be a little bit of a lecture and a little bit of a guided tour through guided imagery. So let's begin. So first, we're going to provide a description of guided imagery. We will then describe the latest research on how guided imagery can improve health. And then we will present how guided imagery can be adapted to improve patient and family health. Finally, we will provide a 15-minute guided imagery session to complete the webinar. And Dr. Meagher will be leading that section. So, what is guided imagery? And take this image in. Well, it's a complementary intervention that has been used for centuries from ancient Greece to the early Chinese cultures, as well as customs of the American Indian. Guided imagery has been shown to facilitate the reduction of stress and anxiety, enhance the immune system, and create an overall sensation of well-being. And I think we all need some well-being these days. Life's been kind of stressful. All ages can learn and participate. This can be done in-home, in the clinical setting, outdoors, just about anywhere. There are a variety of organizations that exist today that train healthcare providers through certification programs to become imagery facilitators or therapists. Parents can use guided imagery to support their children in school, before exams or presentations. It's easy to implement, it's inexpensive, it's portable, requires little equipment, and is not associated with any adverse effects. When performing guided imagery, a person can focus their thoughts or engage towards a specific goal by listening to a podcast, video, or tape recording, or as we're going to do today, use a facilitator to guide them through the process. Guided imagery is based on the concept that the mind and the body are interrelated and have bilateral interactions. Through guided imagery, the brain is stimulated to envision an event in a positive, affirmative manner, thereby developing a mentally advantageous image of the event. The process involves all the senses. So when an image is focused on, the person can feel, can see, can hear, and smell even the event as though it was real. Individuals are mentally transported to a place where they feel safe and are relaxed. One's imagination is harnessed to send messages to the central nervous system. These messages affect the body's physiologic processes. Guided imagery is based on the principle of psychophysiology, where every thought results in a physiologic reaction. A mental image invokes an associated emotion that connects the feeling state with the mind and body, resulting in physiologic changes. Guided imagery can be used with traditional interventions or in conjunction with traditional pain control methods to augment healing. So let's look at some of the research on how it improves health. The national concern over the opioid epidemic has created a revived focus on complementary and integrative health strategies, such as guided imagery, to manage patient pain. There are several studies related to how guided imagery affects pain and healing. I will now discuss the current research regarding these theories. A randomized controlled study by DePaulis and colleagues in 2019 had 104 patients with advanced cancer. This study used a combination of progressive muscle relaxation and interactive guided imagery to distract patients from their perceptions of pain and their physical discomfort. They found that guided imagery had the ability to control pain and improve the quality of life of cancer patients and their associated pain. Pain management was improved and there was a decrease in anxiety. Another researcher, Vagnoli et al., in 2019, determined the effectiveness of guided imagery in reducing preoperative anxiety and postoperative pain in children. Their sample consisted of 60 children, ages 6 to 12, who underwent minor surgery. 30 children were assigned to an experimental group. These children received relaxation therapy using guided imagery and were accompanied to the OR by a parent who stayed with the child during the anesthesia induction. The other 30 children in the control group received what was considered standard of care. Standard of care was a child was accompanied by their parent to the OR, but they did not receive guided imagery therapy prior to the induction of anesthesia. Researchers found in this study that there was a statistically significant difference between the two groups, with less anxiety and less pain for children induced in the experimental group. Another study regarding chronic pain of children was done by Weidert et al. In 2006 at the University of Arizona. Published in BMC's Pediatrics, 22 children ages 5 to 18 with recurrent abdominal pain were randomized to two separate groups. The groups were taught either breathing exercises alone or breathing exercises along with guided imagery and progressive muscle relaxation. In addition, both groups had 4 weekly sessions with a therapist. In this study, all children were measured at baseline for depression, anxiety, and somatization of their recurrent abdominal pain, with therapeutic efficacy of either breathing exercises alone or guided imagery with progressive muscle relaxation. The therapeutic efficacy of guided imagery with progressive muscle relaxation found in this study was consistent with the present understanding of the pathophysiology of children's recurrent abdominal pain. Guided imagery is not common in many pediatricians' offices. In their practice, this is not commonly taught, but a simple non-invasive therapy, such as guided imagery, has the potential to benefit children with recurrent abdominal pain. A study by Windall, Berger, and Kim, published in the Journal of Holistic Nursing last June in 2021, found students receiving personal benefits from a course of guided imagery and thought they could use this technique with their patients in the future. These were nursing students that were taught this process, and they used the process before exams. Guided imagery is valuable for patients in the community as well. For instance, Schlesinger et al. In 2014 evaluated the neurological effects of Parkinson's disease following sensations with guided imagery. Researchers found that after 3 months of listening to relaxation, guided imagery, and soothing musical recordings, all patients in the study with Parkinson's disease had a dramatic reduction in tremors following these sessions. Moving on to a couple more quick studies, we have Jai et al. In 2021, who looked at the addition of guided imagery to home exercise programs following a stroke. Abdullah found it was in 2013 studied the use of guided imagery in the home setting for the management of chronic pain in elderly patients. And Jallo et al. In 2014 also used guided imagery and felt that it was quite successful in stress and symptom management in pregnant African American women. So guided imagery is now being introduced in many, many areas. Once the technique is learned, guided imagery can be introduced into the home setting to address behaviors such as anorexia, bulimia, substance abuse, anxiety, insomnia, chronic pain, and just general discomforts. So there are 5 steps to begin with guided imagery. First, the first one needs to assess the issue. Then you need a relaxed body position that needs to be established. The third step is that you need to concentrate on developing a relaxed breathing pattern. The fourth step establishes a positive imagery environment. And finally, the journey begins. So I'm now going to pass this lecture portion over to our participatory section, to Dr. Meagher, who is going to mention or guide you into this journey. As mentioned earlier at the start of the presentation, Dr. Meagher is experienced in practicing and teaching guided imagery in her midwifery practice at the College of Nursing and in her pastoral care practice over the past 38 years. She's quite the expert. So I'm going to pass it over to Barbara.
All right, so she's literally passed it over to me. Hello, everybody, and welcome. What I'm going to do today is kind of just a start to an experience of guided meditation. Purposefully, I'm going to have you relax and have you come back to the room in 2 different ways, just as an example of ways that you can help somebody become more relaxed and control their breathing and share in the imagery. So this particular meditation that I'm going to walk you through was originally written by Reiki Master Karen K. Mitchell. I have modified it to fit our needs, and that's one thing I do want to emphasize to everybody who is attending this webinar today is that you can look up guided meditations online for free. There are also many books that have many scripts for different types of guided imagery. So some people even will get a script and record themselves saying the guided imagery and then playing it back for themselves whenever they would like to do the session. So there's many ways to go about this. I usually also recommend that if you have a nice soothing type of music that you like to listen to, and it can be any kind of music. It can be rock and roll, it can be opera, it can be instrumental, it can even be country and western. Whatever makes you happy is what can be used in the background, or you can do it silently as we're going to do today. So what I'm going to ask all of you to do right now is to get as comfortable as you can in your chair or wherever you are sitting, kind of shake everything loose. And I would like you to take a deep breath in and blow it all out. As we breathe out, I want you to feel your body letting go and just relaxing. So again, deep breath in and blow out all your stress. And one more time, deep breath in and blow it all out. Now I would like you to just do a quick body check. See if there's any tension that is still left in your body, any part of your body that feels uncomfortable, and just adjust yourself. If I'm in an office setting, I try to make the patient be very comfortable, and I usually tell them to have every joint relaxed and every joint flexed. So it tends to bring in a deeper relaxation if you can have every joint relaxed and every joint flexed. Now I would like you to close your eyes and just listen to me during this meditation. And that's really all you have to do. Just breathe normally in and out, close your eyes, relax, and listen. I want you to imagine that you are in the spot you're in right now, and all of a sudden, you see this beautiful mist come up from the floor. It's a beautiful red mist. It's very pretty. It's very sensationally awesome feeling. And this mist is coming around your whole body. And this mist is very red. It's a very bright, beautiful red, the most beautiful red you've ever seen. Now that mist is floating up into the ceiling. And now you start seeing an orange mist come up. And this orange mist feels wonderful and bright and sunny, and it engulfs your whole being. Now that mist is moving up. Nice and slowly as it moves up, you begin to feel even more and more relaxed. Now coming up through the floor is this beautiful green mist. Now this green mist can be your favorite color green. It can be color lime green or Kelly green or forest green. Whatever green is your favorite, that's the color that this mist is right now. It's like a nice, pretty green cloud, and it relaxes you, and it is now enveloping your body, and all you can see in your mind's eye is this beautiful green mist. Now the mist is blue. Whatever your favorite color blue is, the blue is coming up and the green is going up. As the green goes up over your body and into the ceiling, it is taking any kind of stress or pain or disruption in your happiness. It's taking it all with it now, up through the ceiling, out into the atmosphere. Now you're surrounded by this beautiful, tranquil blue mist. It's all you can see in your mind's eye is you're floating in this blue mist. You're no longer sitting. You're floating in this beautiful blue mist. And just float there for a minute and feel how good it feels to just be relaxed, not to worry about anything, and just be in this beautiful, tranquil mist. All of a sudden, this mist is changing again. It's very delightful. Now it's a purple mist. And this beautiful purple mist is surrounding your entire body. And it's actually going to lift you up into the air. And you feel yourself traveling. You do not know to where, but you are just floating in this purple mist. And it feels so good and so relaxing that you just allow yourself to float and float. And then it gently sets you down at the base of a beautiful crystal mountain. You can see this crystal mountain. It's very high. It's going to take quite a lot of steps to get to it. But you feel totally invigorated and totally happy and totally relaxed. And you know that you can get to the top of this beautiful mountain. As you start to go to the base of this mountain and you begin to climb it, you realize that you are carrying some bags with you and how heavy these bags are. So you stop for a moment and you notice that one of the bags that you are carrying is just too heavy to continue with. So you take this bag off and you examine the contents of this bag. And in this bag is labeled physical burdens. And you look at these physical burdens, this baggage about your physical body, and you decide that you are going to move on beyond these things. So you're going to take the baggage off. You're going to take it and leave it by the side of the path, knowing that you can choose to pick it up on your way back if you want to. You feel yourself move away from these physical problems. You feel them disconnecting from you and becoming distant to you. You feel much lighter now, but the path is becoming steeper. As you decide to continue along the path, you notice that you have brought some other bags along. So you take from your bag the one labeled emotional baggage. Looking inside, you see there are emotions in there that no longer fit you. that are not helpful to you on your journey and are no longer appropriate for you to hang on to. So you take off this bag and you leave it by the side of the path, knowing that you can pick it up again on your way back if you choose to. You're almost to the top now, but as you get to the top, you realize there's another bag. This is your mental baggage. There are thoughts that you have held in your mind that no longer work for you. There may be lies that you have told yourself. There may be judgments that you have of others or yourself. And you are choosing now to leave those behind as well. And as you move higher and higher up to the top of the mountain, you take a look out over the beautiful scenery. You feel happy, you feel healthy, and very, very relaxed. As you sit down at the very top of this mountain, looking over the area, you realize that you could not have gotten up here all by yourself. So at this time in your mind's eye, I would like you to turn around and see who helped you. Who helped you get up to the top of this mountain? And now you see the person coming towards you. This person can be your best friend, family member, living or not living, but you see this person coming towards you and you are filled with light and love and gratitude. And you feel happy and healthy and very, very relaxed. Focus on this person now. You may see them as a person. You may see them just glowing as this wonderful, strong energy or light. You feel your heart begin to fill with pure love as they get closer and closer to you, and you acknowledge and thank them for their presence in your life. Your friend is holding out something to you. It is a gift. You can imagine this gift in any kind of vessel you want. It can be wrapped up like a birthday present. It can be wrapped in paper. It can be wrapped in a cloth. But they're giving you this present. You feel that loving energy flowing towards you, and you realize that you are happy, you are healthy, and you are very, very relaxed. What is in this present is up to you. Whether you open it now or later is up to you. So take the present with you, open it if you'd like, and realize that your journey is full with love and that your body is so filled with love. It's like a gentle rain just flowing all from your body up until everybody and everything around you. It's cleansing away anything that does not serve your higher purpose, anything that does not make you happy, healthy, and very, very relaxed. Now you thank your friend as they walk away down the mountain, and you realize it is now your turn to come back down the mountain and into the room. As you come down the mountain, you feel light, you feel happy, you feel healthy, you feel very, very relaxed. You're going to pass each of the bags that you left on the side of the path. You can choose to leave them there or pick them up and take them with you. As you get towards the very bottom of the mountain, there are 10 steps that will take you back into the place you were sitting before we started this journey. So as you step on the top step, step number 10, you take a deep breath in and blow it all out. And you feel very, very relaxed. Now you step down to the 9th step and you feel more relaxed, but somehow more alert to your surroundings. Now you step down to step 8, closer to the room that you were in, still more relaxed and still more alert. Now down to step 7. As you get down to step 7, you start to feel back inside your body. You start to feel how relaxed you are. how healthy you feel. Then you go to step number 6, again, more relaxed. Then you step down to step number 5, another deep breath in, blow it all out. There's no stress left in your body. You feel happy, you feel healthy, and very, very relaxed. Now down to the 4th step, more relaxed. The 3rd step, even more relaxed. And the last 2 steps, you're going to step down. When you get to the bottom, you're going to open your eyes and be back in your body and be back in the room that you were in. So now you go to step 2, more relaxed. Now the very bottom step. And now when you're ready, you can open your eyes and you're back where you started. Only hopefully now, happier and healthier and very, very relaxed. Okay, and that is the end of our little guided imagery session. I will turn this back over to Pam. If you have questions for Pam or I, you can put them in the chat. And I thank you so much for your attention.
Okay, is there any questions? Does anybody have questions about the guided imagery? We are happy to answer any questions.
We do have one question, it looks like.
Okay,
Hold on.
it says you have been muted for the presentation.
No, go down.
So, okay, sorry. The first question is, how do they learn more about the use of guided imagery with children?
Okay, so as I said, there are several books. I'm sorry I didn't bring a list of books with me. I can send that later. But there are books that you can go on into a bookstore, into Amazon, and buy, specifically giving you pediatric guided imagery scripts. Some are for anxiety, some are for pain, some are specifically for childhood cancers. The only thing I advise is to make sure whoever you're doing the meditation with has a similar philosophy. The biggest example I can give is if you have somebody who's very nonviolent and they have a cancer, you don't want to tell them that the chemotherapy is killing the cancer cells. It's better in the guided imagery to say the cancer is leaving your body, or there are helper cells that are helping the cancer to leave the body, because saying that you're killing the cancer might be too violent for that person, or it might be against their religious or spiritual beliefs. So you just have to make sure that whoever you're doing with, you can modify. There are also many different classes you can take. If you want to take classes, there are online classes. You can also take classes in Reiki, which is a hands-on healing method. And we do quite a bit of meditation in Reiki class as well.
Okay, thank you. And your next question is, how is this different from hypnosis?
In hypnosis, this is a very good question. In hypnosis, there's much more suggestion of how the person should feel. Like you may give them a suggestion that you don't like cake, or you don't like to smoke, or you don't like to feel this way in this situation. So it's a little more like super guided, I guess I would say. This is more of providing you with some imagery, and then you get to choose how you feel about it and what you want to do about it. Whereas in hypnosis, it's more of a suggestion of this is how you're going to feel.
Okay, thank you. And the last question is, they were wondering if they could get a copy of the imagery script.
Absolutely. I can send that to the head of whoever is, I can send it to the producers of this wonderful webinar, and they can send it out.
Wonderful.
I'm glad somebody liked it so much they want a copy. That makes me feel good.
Well, thank you so much. We really appreciate your time and expertise today. And to all of our participants, thank you also for attending. We are having more next week, so please tune in. And thank you so much to our speakers. All right, take care, everyone.
Thank you. Bye.
Thank you. Bye-bye.